Whenever I think about the COVID-19 pandemic, I imagine it like a dark world war. A war not fought by soldiers or military team, but a war fought by the healthcare team. As part of this team, we need to arm ourselves by wearing masks, face shields, and personal protective equipments. But now, slowly, there is light. Now we have vaccines. As a warrior of this pandemic, it is our chance to upgrade our armors, a chance to grab the light and be the light. Despite the good news, I know you have questions and concerns. Let's clarify a few of them. One of your questions or concerns could be, how do vaccines prevent diseases or disease? Vaccines mimic the virus or bacteria that causes the disease and triggers the body's creation of antibodies. These antibodies will provide protection once a person is infected with the actual disease-causing virus or bacteria. Another question could be, how do vaccines differ? Vaccines differ in their composition and how they trigger the immune response to create antibodies. Vaccines can be inactivated, weakened, or killed copies of the whole or part of the virus or bacteria, or genetic products such as the mRNA vaccines that creates protein copies without causing disease. Another question could be, what are the possible side effects of vaccination? The possible side effects of vaccine include pain, redness, itchiness, or swelling at the injection site, which may last a few hours. Fever, feeling of weakness or fatigue, headache, dizziness or diarrhea, or nausea could also be present. Consult the nearest healthcare professional if you experience any of these. Another question could be, is vaccination mandatory? The answer is no. Vaccination is not mandatory, but the government highly encourages the public, especially the healthcare workers, to get vaccinated and be protected against preventable diseases or disease, such as COVID-19. Another question could be, are COVID-19 vaccines safe and effective? The answer is yes. COVID-19 vaccines that are granted with the Emergency Use Authorization or the EUA by the Food and Drug Administration or FDA are considered safe and effective based on the available evidence to date. Another question could be, are there risks for complications when given the COVID-19 vaccine? The answer is yes. Like all other vaccines, there are risks of complications, but severe or life-threatening reactions are extremely rare. The benefit of protection against severe COVID-19 is greater than the risk. Anyone who will get the vaccine will be properly evaluated and closely monitored by the health professionals to further minimize any risk. Another question could be, what is the best vaccine for you? Well, different manufacturers will have different results with their studies. But with regards to the vaccine that we will be receiving, it prevents severe illness up to 100% and protection from mild infection from 65 to 91% in total or general population. This is the available vaccine for now, so it is best that we grab it to be protected and for our security. We don't know when would the next vaccine be available or what type of vaccine. Let's take the opportunity. Let's be vaccinated. If you have other questions, please consult your doctor. Let us protect ourselves so that we can protect others. This is Dr. Daryl Mark Tayaban. Have a good day.